They did that because you had, some fluid in your lungs and stuff like that. And we worry about heart failure. Okay, so the ultrasound of the heart is what tells us how strong your heart pumps, and pumps the blood out of itself and what your valves look like and all that. So on that echocardiogram or ultrasound of the heart, your heart function was about 25 to 30%. Normal is about 55 to 65. So it's not 100, but yours is pretty decreased, okay? So your valves didn't look too bad. Your mitral valve was what we call mild to moderately leaking, but sometimes that can happen when the heart's not pumping strong because the valve kind of gets pulled apart a little bit, okay? So sometimes that can improve, when your heart function improves. The left side of your heart is the one that does the most pumping, let's say, is the stronger part of the heart, because you've got 4 chambers. So I'm just trying to, tell you kind of what's going on. So that one is the one that's decreased, okay, about 25-30%. Now, sometimes this can just happen and we don't know why it happens. It just does. Sometimes there can be a blockage in one of those coronary arteries that supplies the heart with blood and makes the heart weak. And then sometimes, believe it or not, it can be a virus, and we just don't know, right? There's no necessary thing that we find. So, have you ever had any chest pains?
Yes, she was thinking it was heartburn.
Well, that's what it was, because I would take the Pepsi and it would make me burp really loud, and as soon as I burped, it was gone.
Okay, but how often do you have that pain?
Very seldom. They put me on Pepsi, and
you take it every day?
I take it every day, and I don't hardly ever have it. Every now and then I'll feel a little one coming on. I gotta drink some water, and I burp, and it's gone.
Okay. Now what about, so if you had to, when you walked in kind of from the parking lot and all the way up here and stuff, were you short of breath? Were you tired? No chest pains with that? Okay.
No, I walk my dog about a mile a day.
Okay,
So
all right.
I don't get tired walking. If I had to run, I probably would.
Well, wouldn't we all? I used to run, but not anymore. Yeah.
I don't ever run.
Only when someone chases me now. No, I'm just kidding. So, were you ever a smoker?
I am a smoker.
You are a smoker. Okay. How many years, if you had to guess?
I'm 70 and I think around 21.
Okay, so 50 plus years.
Oh yeah.
Okay, and like a pack a day or?
No, I don't even go through a pack a day. It's probably a half a pack.
Okay, all right. So that gives you a risk factor, for underlying cardiac disease.
I've tried to quit.
She can't take the patch.
Yeah.
Or she can't do the patch. The doctor told her that if she did it, that it would kill her. And then I kind of wonder, because she was chewing the gum, and when she chewed the gum is when she would have the chest pains.
Well, that's when it all started. Is when I started on the Nicorette gum.
Okay.
That's when I noticed that I was getting
Like a shorter breath and chest
just
pain.
the chest pain.
Okay.
But it would be all the way across, so I didn't really pay it no attention like the heart.
Right.
I just thought it's
Indigestion.
indigestion. And,
Okay.
She's also said that your heart was heavy, or your chest felt really heavy. That's you told someone that too.
Yeah, that's what whenever those chest pains that I'm telling you about.
Yeah, it feels like a
It
heaviness.
feels like something sitting on me.
So that could have been that she was having a heart attack, or?
Well, so her EKG doesn't show that she's had an old heart attack that we see. Okay. However, we do know that women don't always have the typical chest pain symptoms. We're a little different. You've never been diabetic?
No.
No high blood pressure?
No. Well, I've had high blood pressure up and down, up and down.
You're not treated for it?
Yeah,
I am now.
You're treated for it now. Okay. And
Even though I don't have it.
well, if you're treated for it, technically means you have it, because if we took you off the medicines, it would go up, But it just means that it's well controlled on the current medicine. Okay. So you've got some risk factors. That's the only reason why I'm asking so many questions. Sorry to get invasive there.
You're fine.
I'm trying to decide. We definitely need to do an ischemic workup, meaning to see if there's any blockages in those arteries. There's two ways that can be done. A stress test, right, which is the least invasive way. However, you have a low heart function. You're telling me you do have some chest pain. Now, could it be indigestion? Of course it could be. Could it be cardiac? It could be. Okay? So when I talked with Dr. Grekel, he's the cardiologist, again, that unfortunately didn't, but he's normally over there, and that's who I work with. Usually when your heart function is low like this, if you're not having any symptoms, we could do the stress test. And if it's abnormal, then you get the angiogram. When people have symptoms, we usually skip the stress test and go to the angiogram, because you might be there going that way anyways if the stress test is abnormal. Does that make sense? But it's also a decision you have to make. So the stress test is, we basically, have you walk a treadmill. It's not like running, but it gets quicker and quicker. And we scan you kind of before and after to see what the perfusion looks like, if it's different after exercise, to see if the blood flow is getting everywhere. Those can be false positives and they can be false negatives. It's the best test we have before we do the other one, which is called a coronary angiogram, or like a cardiac catheterization. If you've ever known anybody that's gotten a stent or anything like that, this is the test like that kind of leads to that, right? They go in through your wrist, this radial artery here. Sometimes they have to go in through the groin if they can't get in through the wrist. And they put a small catheter in there. Sounds scary, but he does a lot of them, 4 or 5 a day. But he put a catheter in there and basically drops it into the heart to look with some contrast, dye, to see if there's blockages. That's the best test there is. Without a doubt, with that test, he knows for sure if there's any blockages or not. And at that time, if there is a blockage, at the same time, literally, that you're on the table, his partner steps in and puts a stent in if you need it. So it's done all together. So those are the two options for the ischemic, making sure there's no blockages workup for your, we call it a cardiomyopathy, but just a weak heart, okay? And you do have congestive heart failure with this type of, lower heart function and the fluid that you had on board. I know I threw a lot at you. What are you thinking? I'm a little concerned because, again, if you told me you had no symptoms and never felt anything.
She has an aneurysm in her belly.
Okay.
And that was what we came for that day.
Yeah.
And
pretty small, luckily, though. It's about 3.5 centimeters. Yeah.
So luckily it was showing that she had that, or they had told her that if she had any pain.
Yeah.
And luckily I was like, nope, you're going, because she wanted to stay home, and then we found it. So I think you should get the one test, but that's up to you.
So again, I mean, if you want to try least invasive to more invasive, we can certainly do that. Again, however, I'm a little concerned, with your symptoms. And you do have risk factors. The smoking, I'm not going to beat you up about it now, obviously, it's been 50 years, but, back then they didn't know, but it's a huge risk factor, for blockages in the arteries. It just is, The high blood pressure gives you a little higher risk as well, okay? But you're not diabetic, which is good, because diabetes gives you a really, high risk. So, those are the options. If you elect to do the coronary angiogram or the catheterization, he does them as an outpatient right here at Palm Bay Hospital. You go in that morning, you don't eat or drink, after midnight. You go in that morning, he does the test, and then that day, right? I mean, he doesn't know until he gets in there, but, sometimes he goes in there and everything is fine, right? And there's no blockages. You don't need a stent. That'd be the perfect scenario.
Oh, yeah.
Either way, we treat you with medicines for this low heart function. I'll get to that piece in a minute. But, so think about that just for a second. So let me start talking about the medication management and stuff like that. So even if you were to go in there and find that there's nothing wrong, we still have to have you on medications to try to get this heart function up, okay? And either way, whether it's the stress test or the angiogram, the medications don't change, okay? But if there is a blockage and we don't fix it, these medications likely would not help, Does that make sense? Because it's the
Mhm.
blockages that are causing it,
Mhm.
okay? So, the medications that they have you on, the metoprolol and the lisinopril, I'm gonna have to stop those and put you on 2 different ones, okay? Believe it or not, the metoprolol that you're on is a shorter acting one, and it doesn't really do much to help your heart function improve. So I'm gonna switch you to the metoprolol succinate. They are different, and they have different properties. It's a once a day medication, but that's actually gonna help your heart function hopefully improve. Okay,
Mhm.
so that will just be a straight swap out, right? We'll just swap that one. The lisinopril is not bad. It's the medication we've had for years, and all, it's a great medication, but we have some newer heart failure medications that have proven to really improve heart function. So the first 3 months after being diagnosed with this low, it's called an ejection fraction or heart function, we have to give you 3 months of appropriate medical therapy, which these 2 new medicines would be, and then we recheck your heart function again on one of those ultrasounds.
Mhm.
If your heart function remains less than 35%, then it's indicated that you get a defibrillator, which is an implantable device. We're not there yet, right? I know. That's why it's kind of a lot. But, and a lot of times people's heart function will come up, okay, with these medications, all
Mhm.
right? And even at that point, even if they don't, it's still always your choice, right?
Mhm.
We recommend things. It doesn't mean you have to do it, but that's what the recommendation is. So that's kind of how serious this is, okay? You know, and I'm not trying to sugarcoat anything by any means, but your heart function is low,
Mhm.
okay? It doesn't mean you can't live a good life with it. However, we need to manage it.
Mhm.
Because if we don't, you know, the swelling and the shortness of breath, it's just going to keep getting worse and worse. And you'll probably end up in the hospital a lot, you know.
Yeah.
So I'm not trying to scare you, but just kind of trying to give you the idea of what we're looking at.
Okay.
Now, I know I've thrown a ton at you. You don't even have to make any decisions today. You can actually think about it, talk about it, whatever you want to do. Questions that you have for me right now? I know, I'm sorry, it's a lot.
Yeah.
Anything come to mind? It's all treatable.
Yeah.
You know, it's all treatable, so that's the takeaway, okay? But there are steps that we have to do to make sure. Again, knowing if there's any underlying blockages, that is key, you know, because we can throw all these medicines at you, and if there's blockages and we don't fix them, then it's, you know,
Yeah.
Sometimes a moot point. So, the Entresto is the medication that is really good for heart failure. You might have seen it on TV. There's advertisements. You know, everyone's happy walking around with their heart failure and they're on Entresto. But it really does work. I mean, I'm just...
I actually need to see if I can get it because I have dysfunction and a leaky valve, and
Mhm.
then the heart pumps and then releases the blood out slowly.
Yeah.
So,
But yeah, the Entresto is, you know, kind of a wonder drug, and it can really help with the heart function. So, you would completely go off the lisinopril, and we'll give you samples of Entresto today, or I'll actually can give you a 30-day, there's a 30-day free card, so you go to the pharmacy and get, so we want to make sure to see how you do on it, right? It can be very expensive. That's the only caveat, okay? Very, very expensive. So we give you free at first to see if you tolerate it, if you like it. We do have to check your kidney function, you know, about 2 weeks after starting it, okay? So, what are you thinking about, like the stress test versus
I'm thinking
the
about
angiogram?
the one with the
The angiogram.
coronary thing.
Yeah.
Because I don't want to do it all. I just rather get whatever
Okay.
done.
Yeah, yeah. I mean, given your symptoms and everything, I think that's probably a
But
good
what are you
idea.
gonna, do you put me to sleep?
So they don't put you, it's
You're
not
awake.
general anesthesia, but
yeah,
it's
you're
like,
under anesthesia, but you're awake.
it's like a, but they give you a little bit of fentanyl and Versed. So it's kind of like a moderate sedation. If you're real nervous and, you know, just tell the nurse down there and they give you a little medication just to kind of make you
Well, I'm
sleepy.
just saying,
She's allergic to a lot of
medicine
stuff.
makes me sick.
Oh, well, they won't give you anything then. Yeah, if you don't want anything, they won't give you anything.
I won't feel anything.
Well, it's not like it, you can feel like a flushing, when they put the contrast in there.
Okay.
You know, but like if you've ever had a CT, right, at the, like, you know how it makes you feel you're gonna pee your pants? It kinda comes- Do you ever, I mean, if you've had a CT,
Yeah.
you don't, because I've had one, so it's weird, but it like
Yeah.
almost makes you feel like, you know, you get a little flushed and,
Yeah.
so that you might feel, but usually you don't feel a lot while they're in there, okay? Here they give you like, you know, numbing medicine for just the stick
Okay.
part, right, you know? Once in a while, I'm not gonna lie, people can, it feels funny, because they are putting something up through your arm, you know?
Okay.
But you can talk with them about, you know, what your options would be for, you know, like a little bit of sedation or something like that.
Okay.
And so, and they had all your allergies listed, right, in the
Yeah.
hospital?
Yeah.
Okay, because I got none for here, so,
Well, it's basically all pain medications.
okay,
I don't think I've ever took anything that I could take.
okay,
So I
so
take
like,
Advil.
okay, but you're talking about like pill form and IV stuff?
I, well, never had it in the IV because
Okay,
as
never
far as I
needed it,
know.
okay, because they are different, I mean, there's opiates, but there's
I
different
am
types.
allergic to Novocaine and they have that. Well, when I was in the hospital having my
Yeah.
last one, they had that
Okay.
wrote in big letters.
Yeah, no, that, and I'll
Novocaine?
make sure.
How do you get teeth work done?
Stop Xylocaine.
Okay.
Xylocaine, yeah, so you're allergic to Novocaine, and you're allergic to
And
probably
Finnegan. She's allergic to Finnegan.
like, okay. But you're not allergic to contrast, correct?
No, she had I think she had
Yeah.
contrast.
She had a CT.
Yeah, because you said you felt like you.
Oh, yeah.
Like
Yeah.
it feels weird, like a
Felt,
flush.
yeah.
Yeah, okay, and that was fine, alright. So you're allergic to like PO pain meds, like pills, like hydrocodone, oxycodone, all those, okay.
I've never took
And then what was
Oh.
what was something you took that you were hallucinating one
That
time?
was the tramadol.
Yeah. Okay.
Okay, tramadol. Okay. Yeah, I mean, they won't be giving you any of those type of things, but a lot of times they would give you, if you want, like a little fentanyl and Versed. Fentanyl is an IV medication, but they could give you just a little bit of Versed or something, which is, it basically just kind of helps relax you, calm you, makes you sleepy. So it's not a narcotic at all.
Okay.
But that's something you can discuss with them.
Okay.
Okay. So then what I'm going to do is kind of make these changes on the medications here. And I'm going to give you a detailed list, okay, and tell you what to stop. One other question. In the hospital, was the atorvastatin the first time you took a cholesterol medication, or had you been on it? Okay. Yeah, because your cholesterol was high.
And
Okay.
none of that I was on until I was in the hospital.
Isn't that always the way?
I said I was taking nothing, now I got all these medications I got to get
Yep.
through each day, and I have to spread them out and make sure I eat. And
I
Yeah,
know.
because she didn't tell none of us that she was dizzy,
Mhm.
and then she told us that. So,
Yeah.
but she thinks it's because she wasn't eating a lot when she was in the hospital,
Probably.
so they were
yeah.
giving her everything.
Well, and your blood pressure shouldn't drop too much with changing these two medicines, because they're almost kind of like taking the place of the other one, okay? The Entresto is a twice-a-day medication, though. We start you on the lowest dose, of course, okay? So, let's see here. And they're going to Brevard Health Alliance Pharmacy?
yes,
Okay. So I'm gonna put in here,
Yeah, I kind of wonder if